Hey everyone, I have John Steffenson here today from the University of Michigan. Welcome, John. How are you?
I'm good. Thanks for having me.
How did you end up at the University of Michigan?
Um, I was a student at Eastern. Uh, I was in the music program, and I was about to graduate with a degree in guitar performance, and sort of had an epiphany that it's not. It's I don't want to call it a useless degree, but it wasn't really going to immediately change my circumstances. And so I realized that while I had the opportunity to attend college, I should probably look at something that might give me more opportunities. And I had kind of like a weird day that I stumbled across music therapy. I ran into someone who was talking about it, and I asked them some questions about it, and was kind of becoming interested. And it was really kind of bizarre. I went home and um, I saw my mom that evening. Um, Went to her house, and she randomly like suggested music therapy, but it was a suggestion from my mom, so that kind of was like, good lord. And then my sister called me that same evening and randomly started talking about music therapy. So I felt the universe was communicating. So I started looking into that, and they suggested that I volunteer with a music therapist over the summer. And I volunteered with a music therapist on a dementia unit. um, can't remember exactly where it was, but I loved it. Immediately became very interested in music therapy. I went into the Eastern Music Therapy program, and my internship, I got really lucky. My internship was in Mott Hospital and in the cancer center, like 50-50. And then a position opened up right after I graduated and finished everything and got took the test and was a board certified music therapist. And initially, I thought I wanted to work in adult psych. The position was on child psych. I didn't think that's what I wanted to do, but that's where the position was, and so I took a position in the inpatient psychiatric unit at Mott Hospital, and I never left. Here I am.
Well, we're happy to have you.
Thank you.
Um, how would you describe music therapy?
I liked the short description. There's lots of different ways to describe it, but I think the shortest and easiest to understand. I like this idea of achieving therapeutic goals with the use through music. So any therapeutic goal you can think of, because music therapy is used in an enormous array of situations, and but just simply achieving any therapeutic goal with the use of music.
That's very cool. Do you get to use your guitar skills for your job?
I do. And my job has um, changed over the years, but I like the way that it has evolved. So the biggest way that I use music therapy. So after I worked here for a while, I went to University of Michigan School of Social Work, and um, became a licensed social worker. I'm also a recovering drug addict and alcoholic, and it was sort of this interesting alignment of events where a nurse who had been running kind of like a substance use group on our unit was leaving, and I asked my boss if I could start running that group, and she was like, sure. So I started running a group that I essentially titled recovery, because I think recovery from substance use, eating disorders, depression, they're all very, very similar
Mhm.
situations, and the process of recovering from them is can be very similar. And that just started to snowball, and I started doing like intense substance use interventions one-on-one with kids. I started taking kids off the unit to closed AA meetings in the community, introducing young people to Alcoholics Anonymous. But what I realized, and this is, an important aspect of music therapy, music is one of these things that has an enormous power to establish rapport with people. And it became very useful in if I want these kids to open up to me and allow me to help them and be vulnerable with me, music is a very appropriate way to be open and vulnerable with someone else in a very safe and appropriate way. So when I play music for someone, they recognize that as a risk, and they recognize it as a very, emotionally raw personal communication. And I realized that it helped me enormously in communicating to people that needed to learn about substance use recovery. If they had that music therapy experience with me, it helped that process enormously. And that is one of the biggest epiphanies I've had with music therapy over the years. And one way that it really, like, those two practices have really worked very well together for me. And it's kind of unusual that I've managed to create an environment where I can do both of those
Hmm.
simultaneously. Um, but in general, music therapy, up here, it can be different every day. Some days it can just be like I need to bring the tone of the whole milieu needs to come down a few notches. So we're gonna have a group where we're gonna play some music. I'm gonna play music. I always play live music. I never use recorded music. But I'm gonna play you some music, and we're gonna be calm. Or it can be like, music has a way of presenting. A lot of people communicate things in music that you can't communicate verbally. And nobody really, even though you know what's going on, you don't know what's going on. And sometimes using ideas like that in music to have discussion, to process, certain ideas they may be struggling with, can be easier when it's presented in a music format. Sometimes it's just, we're just having fun. It's a distraction from being in the hospital and doing all these really intense conversations and interventions. And now let's, like, play some music and sing and do something that's fun. So those are some of the ways that I use music up here.
Hmm. For the population that you work with, I read that when music therapy is used with autism spectrum disorders, that they work on certain social and behavioral skills. What is the main goal of using music therapy with your population, with the population that you work with?
Sometimes the goal you're describing is very relevant. With the part of the hospital, the part of this unit that I work with, most of the people on the autism spectrum would be considered more like high functioning.
Mhm.
They do tend to have a lot of those. People, I think this raises a great topic. People call them, social deficits, and I don't like that. I like to think of them as social differences.
Mhm.
And a great example of that is in other situations, they can be an enormous benefit. For example, I've had numerous kids over the years that come up here, and bring their guitar, and they have a lot of musical ability. And especially when you're a teenager, um, I've noticed people on the spectrum actually have an enormous gift in their ability to play music for an audience, especially an audience of their peers. Now, a quote unquote normal person, there are so many barriers to playing music for people because
Mhm.
of our social awareness. And I'm thinking of a particular person. She was very talented, and she could play music for her peers, and she was already at a place that some people spend years and years getting to. It's something I've struggled with, playing music for people that, we want to get into this idea of like, did they like it? Was it any good? And we do these things that make it more awkward and detract from the music and what we're trying to do. And, she had this ability to just play this music, and she wasn't even thinking about like, do they like me? Did they like it? She had those thoughts, but in a much different way. But it made her far more successful at playing her music for people. So I found that to be a benefit in that situation. So
Mhm.
in terms of that population, that could be one way of saying, look at how this is a gift.
Mm-hmm.
Your difference, um, your difference is a gift in this situation. It's helping you do this thing that most people can't do, or it takes them years to overcome these thoughts and feelings. And that's one thing that comes to mind. And then there's some basic things like a lot of those goals you talk about, like how to interact appropriately, like being patient and being respectful, and just simply making it through the group can be a goal. Can you um, sit still and listen to this music, and like what do you need to do that? And music can be a medium for like, can you do that? Can you participate in this activity? And that can be a stepping stone to doing other things.
Mm-hmm.
And it can go on and on.
Mm-hmm. I really love that mindset. There's that positive John again. Um, do you feel like music therapy is more effective than a non-musical approach?
With any therapy, and I think it's especially relevant to therapy, everybody's different, and music therapy does extraordinarily powerful things. Music in general is an extremely powerful force, presence. I'm struggling to find the right word. For some people, it's very, very effective, and for some people, it's not at all.
Mm-hmm. Mm-hmm.
So it depends, and some people respond well. And I've learned if it's not the right thing, I don't. There's a lot of pressure for kids to attend all groups. That'll be a thing that they'll be encouraged to do. But I try to, if it's not their thing, I give them the choice with zero
Mm-hmm.
consequence. You don't have to come. My goal is to not make them miserable, um, and it can detract from the whole group if there's someone there who hates it. And everyone's different. Some people react very well in music, and some people don't.
Mm-hmm.
And I think that's very true for music therapy, and also true for other therapies. But I'm certainly not in a position to like say whether or not it's more effective than other therapies.
Mm-hmm.
I don't know. We'd have to get some other representatives here
Yes, that is true.
to
Actually,
defend their
based on my
case.
research, they don't know either. There's not enough research. um, but I think it's probably because it is so individualized and based on the person that you're working with themselves.
And there are instances where music therapy has come in and done like made enormous leaps where other things have not.
Mm-hmm.
I'll try to keep it brief. There was a situation in neurological music therapy where um, I believe people had Parkinson's, and one of the things that people lose in Parkinson's, is their ability to walk.
Mm-hmm.
And these neurological music therapists, there's this great video, and I think it caused a big splash in the medical world. This guy had pretty advanced Parkinson's and had a very poor gait. And this music therapist she asked him to pick a song, and he picked "You Are My Sunshine," and they sang it together. And while singing with the therapist, she said, "Step to the beat," and he walked effortlessly across the room as before he couldn't walk. And um, then she had him just sing it in his head, so suddenly he could just stand up and walk across the room. And it was like this enormous problem
Mm-hmm.
for him, solved simply by. And the same thing can happen if you put an image of stairs on the floor. So essentially, the part of his brain that said walk was no longer working, but the
Mm-hmm.
part of his brain that says dance still was. So it was just like redirecting to that with music therapy. But so there's some instances like that where music can do things that other therapies have failed at. But I think you could say that about any, type of therapy.
Mm-hmm. I would love to hear what is your favorite part about what you do.
That's a difficult question. I struggle with favorite questions because it
Top
changes.
top few reasons then. Favorite questions
Um,
are hard.
that I like about my job in general or music therapy.
Your job in general.
Um, I really like being of service um, to these kids. I like making connections with them. I like seeing them improve, and sharing, my past experiences in a positive way because they were negative for so long.
Mm-hmm.
Um, I like that I'm very busy all day and I enjoy what I'm doing,
Mm-hmm.
for the most part. And I feel a lot of gratitude to have a job that I really enjoy, that I look forward to going to. And um, there aren't like periods where like I fear boredom. I
Mm-hmm.
don't have that. And there isn't a lot of tedium. Um, I like my coworkers. There's a lot of things I like about this job. I feel very fortunate.
That sounds awesome. Very fulfilling.
It is. It's rewarding.
Mm-hmm.
It can be the opposite. We are witness to a lot of really bad situations and a lot of suffering, but
Mm-hmm.
it can be very rewarding, and when we can have an impact.
Mm-hmm. Is there anything that you've noticed with music therapy specifically that can be researched further or that you think could be used in other places that it's maybe not being used now?
Yes. um, I think it's endless. I have all these thoughts all the time. Uh, uh, one thing that springs in my head is I feel like there can be a lot can be done about hospital environments in general. It's less like that here on the psychiatric unit. It's a much more normal environment, but I really struggle with, the more typical hospital environments and not being, they don't feel very conducive to healing, very comfortable or very human. And I think music therapy can play a role in that, along with a lot of other things. I think people would get better faster in a more human environment.
Mm-hmm.
It's very sterile, very mechanical. I fortunately haven't had to spend a lot of time in one, but have witnessed people spending long periods of time, and I would struggle getting better in that environment. And I know that to some degree that serves a purpose, but that's one thing that pops in my head. But I think, there's a lot of situations that can be improved with music, especially therapy wise. But I don't think I can get much more specific than that at the moment.
I mean, you would say that you've already brought music therapy into the group that you work with that you took over.
That's right. And using music to enhance like a substance use intervention.
Mm-hmm.
Yes, that sort of happened on accident. Um, uh, and I think it could be used more in trauma. I did an intervention as an intern, um, with a young woman who was facing cancer treatment that involved, uh, first resection of her finger, but the possibility that could then involve removal of her hand and possibly her arm and so forth. And
Mm-hmm.
with a trauma history on top of that of her father dying in the hospital when she was young, and I helped her, to write a song,
Mm-hmm.
communicating her thoughts about that, and helped her and my supervisor. We actually recorded it at the Duderstadt, at the
Oh,
medical,
yeah, yeah.
sorry, the music school. They have
Mm-hmm.
an extremely fancy recording studio,
Yeah.
and we recorded it there. And I don't hear a lot about, and I could be wrong, about music therapy being used in, trauma interventions, and that's something that interests me. Well, we see a lot of that up here, and I think that was very useful. At least, um, this young one reported that it was very helpful. And also, there was a lot of good things about it. It helped her come to the hospital. We would work on it in the hospital when she'd come for appointments, and it helped get her past that fear of the hospital and that looming terror for treatment, to have this thing that she was doing at the same time where she could express those feelings in a way that wasn't extremely painful but effective, and it helped her get through that time. And I think there could be more of that type of intervention. That's not
Mhm.
typical.
Yeah. Well, thank you for sharing all of your thoughts on music therapy. You've been a fantastic guest.
Thank you. It was my pleasure. Thank you for having me.
Anytime.